So now that we've finished lunch, I want us, before we go into the afternoon session, to get really, really present because we have a really special guest here with us today. Miss Mary White will be making her way to the stage so that we get the all-important perspective of someone living with allergies, with asthma. As we've been talking about today, there's lots of good research, we have lots of great practices in place, but at the end of the day, it's really about how this is implemented by the people who are living with asthma. And Miss Mary White is someone who is going to tell us a little bit about that. Not only is she living with asthma, but she is the parent asthma leader for the Boston Office for Fair Housing and Equity. She is also a community health worker, certified by the state of Massachusetts, and a surrogate patient advocate for the Federation of Children with Special Needs. She was diagnosed with asthma while she was pregnant with her third child at age 30. She's passionate about using her voice to educate, support, and uplift others who cannot speak for themselves. She believes that everyone, regardless of race, religion, or social status, has the right to good health and quality of life in the healthiest and safest environment possible. Please join me in a warm welcome for Miss Mary White.
Thank you, thank you, thank you. Good afternoon, everyone. I love these opportunities to talk to everyone on all levels. That was very nice, that introduction, but this is me, Mary White. I am a mom, a wife, a daughter, auntie, but I'm gonna keep this right to the point. This is a new tool that I just have. It's not like the nebulizers isn't enough. But listen, I wanna talk to everyone. First, I wanna welcome everyone, people online and everyone in this room that took the time out of their schedules to be here today because you knew this summit was gonna be available and you wanted to get something out of it. So I'm gonna make it brief. Don't, it's good. Being diagnosed with asthma at an late in my years was very scary to me. I was living in public housing, and I didn't even think I could give birth or have any more children. And I was about maybe 6 months pregnant, and one afternoon I just couldn't breathe. I don't remember very much, but being taken into the Boston Medical. Unfortunately, where I was living was public housing. I was living in the house with mold, and please don't make judgments, anyone, but we did have pests. And it doesn't matter how clean you are, pests have a tendency of surviving. I think if we had a nuclear war, there would still be some little pests there. They would outlive us. But because of my journey and finding out that I had asthma, and a few months later, I actually had children born. I have Irish twins, and they were born early because of the issues that I had with my asthma. So later in the years, a couple of months later, I gave birth, and then my babies had asthma. But they can't diagnose children with asthma until they are older. And you guys know that. I don't want to teach the teachers. But the reason why I started doing what I was doing, because when you have children, you have to understand you're going to entrust them to people because they can't be with you 24/7 because they go to Head Start, they go to elementary school, and my kids are college graduates, so that tells you how we work. But I want you guys to understand, when you are a person who believe in helping others. My journey has been, I've been helping on different levels. When my children were finally going to school, Head Start, I had to be involved with the Head Start case managers and let them know about asthma because even though children were there, they really didn't have the clue. So I assumed that, okay, I'm gonna be a parent, so I need to let them know things that's going on in the school where my child is that can't happen. For instance, if you send your child to a daycare or early Head Start, why would you want a fragrance plug in the wall that's actually triggers to your children, which is actually gonna call you home from work, you're low income, you're trying to make money, but every other day you're getting a call. So now I have people that I got connected with who were giving me trainings. And this is the thing. Parents, we say we have to go to work to make the money, but wouldn't it be good to make the money and also make sure our children are healthy? We have programs here in Massachusetts. Yes, I'm glad I'm here in Massachusetts. Okay, we have the Boston Public Health Commission, Eugene Barrows. Eugene Barrows is in the room. Eugene Barrows was someone that I met when I couldn't even speak because I kept crying because I was a mom that was tired of being at Boston Medical. It's like every day, every other day, the people knew our names. They're like, oh, you're here again. But the commission provided trainings and workshops for us. And you know what was so amazing? They didn't make it early in the morning in their 9 to 5. They made it available for us. And I say us because I have Bridget Hickson in the room. She's also a parent asthma leader. And we could learn. We had to learn. We know about the Breathe Easy at Home program. That's another amazing program. And that's Darius Jordan in the back. And even though Darius is extremely, how can I say, busy with all the others, even though it's been years that if I have a question or I need a support or I need to refer someone to the Breathe Easy at Home program, because people, let's face it, they do not trust the people who are with the programs. Because as I said about the pests, you can go and have a referral for ISD, which is our inspectional services here, and I know the other states have the county who come out. If your living isn't correct, do you know you may have moldy rugs, you may have rodents, you know, other issues, but they don't trust people coming in their homes because you have to gain trust. So what I'm saying to everyone is, never make judgment. If you're out there, stay involved with your families. Don't say, oh, they won't answer the phone today. They're not doing that. There's other things going on. You have to step down and get into their world. Another thing, I want everyone to pretty much understand that language. We're in another generation now where they do a lot of communication with their phones, texting. Don't say, well, I tried to call that parent, they won't answer me. Never give up and say, I'm not going to pursue these people. Oh, they have a different language barrier. You have to meet them at their levels. I want to let me go back to this, and this is bothering me because I have to push it all together quick. Just because I'm a parent and I have children with asthma, I wanted to help others. I meet people who say, I could be in the grocery store and someone will say, I'm so tired, I don't know, I don't trust the medicine, my insurance only covers one inhaler. We introduced them with the asthma action plan because they had an inhaler at home, but the child is in school or it's in school, and then they have an attack at home. So we worked through legislation to put a bug in their ear that we have to do something with our healthcare system. We have to understand what people need. If you're at a person's level and you listen, the most important, crucial thing is that you have to listen to what the people need. We've seen things on the board, but no one legislation, no one talked about legislation and talking to the people that we actually put into these seats that are supposed to be our voice. So you have to communicate. Another thing, when we started doing the trainings, workshops, other things to help people, like Boston Public Housing. Even though I lived there, it wasn't just about me. I wanted to sit to other parents, so the commission helped us. They had trainings to teach people that if you store your items like cereal and things in containers, you'll be amazed how that can help eliminate the little pests. But who would know? And then the parent might say, I don't have the money for that. So the commission is great because they came up with gift cards to places like Target or Stop and Shop. And then we got on boards at Children's Hospital because those are where you're taking your children in Boston Medical to have their care. So why not organize groups of these parents? Why not make them feel welcome? Why not listen to their story? It's like you have a job, and everyone here is doing what they have to do. Bridget and I, we were on a committee. This is crazy because you wouldn't even think this mattered. But we helped organize environmental committees. in your schools. We have janitors and custodians. They were going to actually lay off the custodians. Can you imagine laying off custodians with the risk of asthma rising, rodents running across this room floors, and you're going to get rid of the custodians? So what happens then? One child seen a mice run across his desk. All that mother had to do was give us a call. So then we start making phone calls, and the phone calls are like this. It is to say, a parent may be shy. They may not want to talk about that. They may not want to hear that your kid's in school. Don't keep your children home from school. Let's make a solution. Let's get the school nurses on board. Let's get the custodians at the table. Parents, and if ever, in a school, administrators, because those are the ones that make the rules. And the teachers, you have to have them at the table, because guess what? That teacher's in that classroom, and I'm telling you, I don't know anyone that likes little mice and things running across their room. So you see what I'm saying? So it's always communication and collaboration. And you must never forget that. Never, never. So even with our journey, someone said, Mary, all the work you guys do, you are a community health worker. So the commission provided. I had fallen, and I went to a training again. Even though the things at the training I knew, I had to get my certification. So I am blessed. I'm actually certified community health worker for the state of Massachusetts, but over the summer, we went to South Carolina. Okay, South Carolina, a family member said, oh, I want you to get my niece to come down. I went, and it was amazing because I spoke with them. They have a board of health. It's a little bit different how it works there, but the same regimen. And you never forget the work that you guys are doing. Never look down on anyone, and never get frustrated, because I'm going to tell you the truth. If you're helping a family and then something comes up, and then all of a sudden you hear that this is something they should have told you in the beginning, you know, and all of a sudden here you go. Never give up on them. So I'm going to tell you guys a little quick, listen, I'm going to get off the stage, so I don't want to bore anybody because there's a whole lot of great things going on today. Because of the work that we've been doing and our commitment, we're asked to do studies, okay? And we are working now with young people and adults because we want to, how can I say, improve this. We've been talking about asthma and other issues, but if asthma's, as I say, sexy, then everybody wants to hear about it. But when it's not, okay, we have diabetes, we have all these other health issues, and some of those health issues are actually coming because the people are frustrated with the asthma. So the thing is, if you can take part, if you can get an organization to support you, and this is another thing, because I heard someone mention about where I'm from, we don't have funding for asthma. Hey, switch it, switch it. Every state that I know, because I have sons and they have teams, every state has teams. A lot of athlete teams have members in their families with asthma. A lot of them have asthma. You can reach out. You can raise your own money. Don't let funding hold you back from helping families, because this is life we're talking about. So I want you to just step outside the box, say, okay, take a chance. Take a chance and try to communicate and see what happens. And I guarantee you'll be amazed that you'll say, oh my goodness, I never knew that person had asthma. But just don't give up on the work that you're doing. And I hope I actually covered everything, because she gave me 5 minutes. I'm trying to be respectful. I have never done this in 5 minutes, guys. Woo! Thank you for having me today. I just want to shout out to Bridget Hicks, and she's a parent asthma leader also, and also her children have asthma. And Eugene and Darius, I love you guys, because you never give up on us. And that's another thing. Keep your connections going. You know, my nanny would say this, never burn a bridge. And I said, what in the world is she talking about? Now I'm an adult of age. You can't go back. So you might as well keep it going. And why not? If you hear that someone has a grant or something that they got, hey, ask them, what did you do? How did you get that? Because you got to keep this thing going, guys. I hope I covered everything and didn't bore anyone. You good? Okay. Thank you. sick of this too. Do you mind? I'm so tired of this too. I'll be done with this soon. Let me have this.
Got it? Okay.
Thank you.
Thank you. I think she deserves another round of applause. Wow.
Sorry, can I just make one quick comment? Between you guys and the Washington recognition. Actually, we're thankful for Mary White. She's very modest, but she is the reason why we had an asthma program. When she raised hell when she lived in public housing, and our mayor back then, Mayor Menino, who passed away, she actually said, you know, the city has to do something about and respond to the high asthma rates in public housing. So I just want to say this. So because of Mary, we hired an asthma coordinator, and then we formed back then a Healthy Homes program, and then we obviously got our asthma home visiting program going. So I want to say this, that advocates, community advocates, is important because they bring funding, they bring attention, and politicians and legislators listen to them. So, city and, city agencies, we can bring all the data, but sometimes it's not effective if you don't have voices, advocates like Mary White. She's amazing. Give her a round of applause. Thank you. I just want to say that. Thank you.
Mary, I'm sure all of us would love to just sit and soak up all of your wisdom, right, for the rest of the afternoon if we could. But I will, if you're open for it, a couple of questions. If there are any questions? No? Well, Mary will be here for a little bit. We have one.
Miss Mary, thank you for your testimony. But quick question I had, and one of the things you said was never make judgments. I'm with the Cook County Department of Public Health in Illinois, and we have built out a Healthy Homes program. And one of the things that I'm putting together now are healthy home kits for families. And one of the things that I've seen in many healthy homes kits are rodent traps and roach traps and things like that. And I said, no, I don't want to put that in the box and give somebody, simply because I didn't want to make that judgment. But I wanted to take this time to ask you, would that be an appropriate thing to put in there, or would that be something, I said I didn't want to put it in there because I didn't want to make that judgment, but I know that it is something that helps with our Healthy Homes principles.
Have you spoken to individual families, or are you just making kits to give out?
I'm making kits to give out right now.
Have you ever thought about you can do that, but each family has a different situation going on.
Correct.
Because what if you live in a place where you're afraid you're going to be evicted because the owner says, if you tell someone that the house isn't up to standard, I will evict you. Why don't you just do some type of education to each and every family? You may find someone will reach out, let them know that you're available, put it that way, if they need additional education, because here we have something called Healthy Homes, but there's so many states that doesn't exist. And people are being put out when they complain. So you need to educate families and let them know their rights. First, you have to find the rights in your state, because it varies. But never just assume that a person wants to look at a roach trap and,
Correct.
that's a turn off. Then they will think you're looking down.
Correct.
Okay? Love Illinois, we work with them in the Prepare Project.
All right, thank you.
Thank you. Thank you so much, Miss Mary, for your time, for your emotional labor. Thank you for coming and you saying you didn't want to take up time. We want you to take up space. We need people like you to take up space. That's why we're all here today.
And I want everyone to understand something too. If you are working with parents, try to see what parents aren't employed at the time. If a parent isn't employed, they may, because they're stressed with taking care of their children, why don't you offer them a gift card? Why don't you just offer them a meeting and come out and educate them? It's okay what I do, I love what I do, but my dream is to have people like me. And I'm telling you, if you're a parent, I don't care what your age is, or a grandparent raising your grandchildren, and young people, educate them so they can do this. This is not that hard. And everybody has a story, but you have to give them the tools they need. So once you give them the tools, oh my goodness, look out, because they'll come at you, okay? So don't forget, don't share it, share the knowledge. Education is crucial.
I just encourage everyone to just take a minute and really absorb all the wonderful gems that we learned this morning, and certainly from Miss Mary White right now. Take a minute and just reflect on that. Finish your lunch, take a quick break, and we'll be back to start the rest of our afternoon, which will start promptly at 1, so you have some time.